be we can continue to address the past harms and rectify the situation for the future through our actions. Together, we can lead to a significant and lasting change for Indigenous people and all Canadians. Miigwech, nakumik, Marcy, thank you.
Merci.
Minister Hajdu, whenever you're ready.
Well, thank you very much to my colleague, Minister Miller, and thank you so much, everyone, for joining us today. I am on the traditional territory of Fort William First Nation, who is a signatory to the Robinson Superior Treaty area, which is also has significant contributions that have been made over the many, many years by Métis people of the region. Today was a moment to discuss with many experts who have recognized that the health systems that serve us are broken for Indigenous peoples. And the many people who spoke are extremely committed to leading the change to address systemic anti-Indigenous racism through substantive action. I first of all want to thank and recognize the Indigenous health professionals who gave and have on an ongoing basis, the midwives, nurses, physicians, advocates, leaders, and youth who have contributed to building and guiding the conversation in place over the last 2 days, and I would say over many, many years. It is their ongoing commitment to advocacy and activism and to continually coming together. And today, it will help us meaningfully address racism together and improve the health and well-being of Indigenous peoples, and indeed, I believe, all of Canada. This systemic change does take time, but many Indigenous people don't have that time. And that's why not only do we need to act quickly, we also need to act together so we can achieve that systemic change and we can begin to make all health systems safer and fairer and more accessible for Indigenous people. I know firsthand that Indigenous peoples continue to experience violence and discrimination as they try to access health services in communities all across this country. Indigenous people in Canada face significant barriers to accessing healthcare that others in Canada do not, and the racism and the bigotry that they face when they do seek care is unacceptable. That's why we need to enact measures to prevent racism and discrimination from happening right now. And as part of this work, Health Canada will establish a new program with the funding that we received in Budget 2021. And this funding will be dedicated to addressing anti-Indigenous racism in health systems across this country. The nearly $15 million program will provide funding to Indigenous organizations and health partners that will support projects that can come up with and implement systems-level solutions to addressing anti-Indigenous racism. It will also help build that capacity that Indigenous partners are building oftentimes alone to enable meaningful engagement on the development of policies and programs for health priorities. Our government is committed to continuing this work with health organizations, Indigenous, provincial, and territorial governments, and other partners to fight racism and to ensure equity of access all across this country. The discoveries made recently in Kamloops and Cowessess are extremely painful reminders of Canada's failings, ongoing failings in the treatment of Indigenous peoples. And so it is our duty and our opportunity as a government and as a nation to address these failures. We must act today to right these wrongs. So today we are making a commitment to Indigenous peoples in Canada and to all Canadians to address these inequities that have persisted for far too long and have cost far too many lives. Thank you. Miigwech.
Thank you, Minister Hajdu. We'll now take questions from journalists, one question and one follow-up. Nous allons maintenant répondre aux questions des journalistes, une question et une question de suivi. Opérateur, première question, s'il vous plaît.
Thank you. Merci. If you have a question, please press *1 on your device keypad. Si vous désirez poser une question, veuillez s'il vous plaît appuyer sur les touches étoile 1 de votre appareil. You may cancel your question at any time by pressing star 2. Vous pouvez à tout moment annuler votre question en appuyant sur les touches étoile 2. The first question, la première question, Mackenzie Gray, CTV News. Please go ahead.
Hi, ministers. There have been a number of cities and communities throughout the country who've decided to cancel their Canada Day celebrations. I'd like to hear from both of you on what your thoughts on that are and if you think it's the right decision for those cities to do that.
I'll perhaps speak first, and then Minister Hajdu can add. Thank you, Mackenzie. I think what we've seen across the country is an awareness of the fact that many Indigenous communities are in pain. They're reeling over the news and dealing with foremost their own community members that are reliving painful memories, opening up wounds that they thought were closed for some time, seeing their youth discover this for the first time, and this is something that is very painful. And obviously, as a matter of respect, you've seen mayors that have taken this difficult decision to tone down their celebrations or cancel partying. It's out of profound respect for what's going on in this country. I believe that they're doing it, and so I certainly respect those decisions. I think this is a time to reflect on our country and what it is, what it represents, and this is something that is really not ascribed to any political stripe, to the best of my knowledge. When you look at the various municipalities that have taken this decision, Mackenzie, it's just a decent, respectful thing to do on behalf of people that are understanding that there are people that are in a lot of pain. And so, as a neighbor, the last thing you do is throw a party when the person next door is grieving. And that's sort of it goes to sort of a very visceral reaction that seems natural, and in their position, I would probably do the same thing.
Do you have a follow-up, Mackenzie? Oh, sorry, Minister Hajdu, please go ahead.
Oh, that's okay. Well, thanks, Mackenzie. And it is a difficult decision, I think, because of course there are lots of things to be proud about. This country has many, many things to celebrate and many things to be proud of. But as Minister Miller has pointed out, there are many, many really sad and terrible things that have happened in the formation of this country. And of course, it's not just Indigenous people that are coming to terms with this reality. It's actually non-Indigenous people as well. Although the Truth and Reconciliation Commission, very extensive support very extensive report has outlined this in words. I think the findings of the burial sites is such a vivid thing for so many Canadians that didn't read that report, that haven't learned about residential schools. And so I think I respect the decision of municipalities that are choosing not to have celebrations. I personally am reflecting on how I commemorate Canada Day myself as a member of Parliament who represents my region as a federal minister. And it's nothing new, actually, for me in terms of my reflection. Mackenzie, you might remember that as the Minister of Status of Women, the first job I had for the federal government was to listen to the stories of families who had lost women and girls in sometimes terrible circumstances. And it was a profound responsibility to listen to those stories as a representative of the Crown. So I respect these are difficult decisions, and I am also, as an individual and as a member of Parliament, reflecting how best to commemorate Canada Day in a way that respects the grief of the many Indigenous people in my region.
My follow-up question is for Minister Hajdu on vaccines. We're getting reports out of Atlantic Canada that a number of pharmacies out there have had to throw away Moderna doses because there has not been the same demand for Moderna as there has been for Pfizer. is the government expecting that since we got such a big shipment of Moderna fairly late in the game in terms of our immunization strategy, with only a significantly smaller percentage of Canadians getting a first shot of Moderna, with significantly more people getting Pfizer, that this could be a problem across the country where more people are lining up to wait for a second shot of Pfizer, considering they got a first shot of Pfizer?
Well, thanks again for the question. My first message is to Canadians. Please accept the second shot regardless of the manufacturer. The science is clear. These vaccines are equal in their protection. The real important piece for Canadians to know is that the second dose provides significantly enhanced protection against some of the more contagious variants like Delta. So it's very important that people get that second dose as quickly as possible. And we are seeing people do that, by the way, Mackenzie. It's great to see people talk about their enthusiasm to get that second dose. We'll continue to work with provinces and territories as we have on their supply and on their anticipated flow through of that supply. Canada is in an enviable position in that we have so much vaccine arriving week over week. We anticipate that we will be able to have a significant number of Canadians fully protected by the fall, when we start to see people moving indoors, schools hopefully resuming activity. And that's my goal as the Minister of Health, to support provinces and territories to get those doses in arms as quickly as possible. Again, I know Canadians want to protect themselves and their families and communities, so keep going, Canada.
Thanks, Mackenzie. Operator, next question, please.
Thank you. Merci. The next question is from Max Paris, CBC News. À vous la parole.
Hi, ministers. Can you hear me? Hello, ministers. Can you hear me?
Yes, we can hear you.
Yep.
Oh, okay, great. Hey, thanks very much. It's Max Paris here from CBC News. I'm just asking this of Minister Miller. This is on behalf of my colleague, Olivia Stefanovich. She wanted to know, is the federal government planning to send an observer or representative to the meetings Indigenous leaders are planning with Pope Francis in December? And if yes, who would it be?
Not that I know of. I mean, it would really be up to them to ask us to participate. This is their meeting, and I hope it's a productive one. But I don't have an answer for that. Really wouldn't be up to us to ask to participate. But I need to get the facts for you. Really, the Indigenous leaders, if they want someone there, they could ask, and we'd be glad to show up. But to my knowledge, there isn't anyone going. But I don't have a full picture of that yet, Max.
Okay. Just as a follow-up, will the federal government continue to press the Vatican for an official apology for residential schools after these meetings between Indigenous leaders and the Pope? And will the federal government resurrect attempts to have the Catholic Church pay its full $25 million to residential school survivors, which was required as part of the residential school settlement agreement?
So your first question, absolutely. Any act of healing requires a full recognition of harm done and apology, and that has not been given by the Catholic Church. People expect to see Pope Francis deliver that in a full, complete, and comprehensive manner, and that will help with the hurt that's being felt by many members who have not, by many Indigenous peoples who have not received that, and we will continue advocating that relentlessly, in obviously in the respectful way that people would expect us to behave vis-a-vis the Catholic Church. And when it comes to the compensation that was insufficient, any sums that the Church can contribute to help with compensation and healing, will continue to advocate. It was a very, very puzzling decision that was made with respect to that $25 million, and I think it's a head scratcher for a lot of us.
Thanks, Max. Operator, next question, please.
Merci. Thank you. Once again, please press *1 on your device keypad if you have any questions. De nouveau, n'hésitez pas à appuyer sur étoile 1 si vous avez une question. The next question, la prochaine question, Stephanie Taylor, the Canadian Press. Please go ahead.
Thank you for your time, ministers. Minister Miller, we're continuing to see reports of Catholic churches being vandalized, being burned, and police investigating. Do you believe this to be linked to the discoveries of unmarked burial sites at the sites of former residential schools? And do you believe we are seeing this kind of crime and vandalism happening because the Catholic Church has so far not apologized, which is what survivors are calling for?
Stephanie, as we've seen some righteous disgust with the immobilism of the Catholic Church on this matter, I think that obviously pain takes many directions in how people express it. No one is encouraging vandalism or the destruction of churches. There are people of faith that are seeing this with consternation. There are active police investigations ongoing, so I will not comment any further, but the proximity to or location in Indigenous communities leads people to believe that there's a connection. Certainly, I would not want to speculate more, given that there are active investigations ongoing, and I'll leave it at that.
Stephanie, do you have a follow-up?
Yes, thank you, Minister. Your department says it has so far received about 100 initial inquiries to access some of the $27 million provided to First Nations to search sites of former residential schools for graves and for commemoration and to memorialize the remains of those found there. Is the government willing to provide more than the $27 million already pledged?
Yeah, and we already are, and I would say that the inquiries and funding announcements vary in their shape and form. It can be anything from supporting community consultations as to whether to take that next step. It is a very difficult internal decision from a community if they want to actively search a site. To those that are, they have various envelopes of financing that we can help them with, and we already have provided supports that go over and above what would normally fall into that 27 million. The amount, as you well know, Stephanie, was allocated in budget 2019. It didn't contemplate the large demand as a result of the events in Kamloops in particular coming in all at once. People were, and those that have been doing more extensive searches have been doing these for years, indeed decades. So obviously the volume is one that we are preparing to respond to, and we have already provided sums over and above what would normally fall into that, and we are prepared to deploy more. Obviously, we'll be with communities every step of the way on this, depending on the quality and scope of the search that they want to undertake. There are other communities that are well advanced and want to, for example, destroy a remaining building. We'll help them with that. That wouldn't normally fall into that strict category of the 27 million. But again, it is very much something that will evolve over time, and we'll react to support communities financially as we have in the past. And I would also highlight in that, and there is one that is very difficult to quantify, is the impact on people's mental health. Obviously, that has been cresting since the pandemic, throughout the pandemic, and the increased impact of problematic substance use, including the opioid crisis, on people's mental health. And that is something that we will need to continue to address as a government, both in the short, medium, and long term.
Thanks, Stephanie. And this concludes today's press conference. Ceci met fin à la conférence de presse. Merci.